Hello, thank you so much for viewing this presentation. My name is Barbara and my topic is I have IBS, so will a low FODMAP diet help me? When we were selecting our project for this class and selecting our topics, I was chomping at the bit to get this one because this topic has very personal significance to me as I am a person with chronic IBS. So doing this research on this subject has been very rewarding and insightful for me as it's always been a topic I've wanted to learn more about. So without further ado, let's get into the presentation. So here's a brief overview of what I will be discussing for today's presentation. Before we dive in deep into the deep end, I wanted to provide some definitions and some background around IBS, and then I will discuss a review article that summarizes the research from approximately the past decade, and then I will discuss the mechanism of IBS, and then I will discuss the 3 research articles. And then I will get into my final conclusions, personal anecdotes, and final takeaways. And the last slide, of course, is my poster for a lay audience. So just for everyone's general comprehension, IBS stands for Irritable Bowel Syndrome and is a GI disease characterized by abdominal pain and abnormal bowel habits. And there are 3 subtypes. The constipated predominant type, IBS-C, the diarrhea predominant type, IBS-D, and then the mixed type, so a bit of both, IBS-M. And when it comes to IBS research, we do have the validated measurement tool to understand the severity of symptoms. So that would be the IBS SSS, and it is the severity symptom score or scale. So it's a questionnaire and you give answers on like a Likert style scale, and then you are given a score. And then higher scores indicate a higher prevalence of severe symptoms. So the IBS SSS is used across pretty much all of the research. And then FODMAPs, of course, are going to be those fermentable carbohydrates, including oligosaccharides, disaccharides, monosaccharides, and polyols, which literature suggests are difficult to absorb and digest for those with IBS. And specifically, a low FODMAP diet, or LFD, the idea is that it decreases the fermentation and osmotic load because you're decreasing the amount of fermentable material that a person is consuming. And then just a subtype of a low FODMAP diet is the Mediterranean low FODMAP diet, which is mentioned in one of our research articles today. It was done by an Italian study. And then the NICE is the older, more traditional approach, especially in Europe, for IBS treatment. So it was developed by the National Institute for Health and Care and Excellence. It is guidelines to treat and diagnose IBS symptoms. So that is usually the control diet when it comes to our research articles we'll be discussing today. And then another basic definition is FFQ, Food Frequency Questionnaire. This is important when we get into how they were measuring intakes. So just to give some background on IBS, it is one of the most prevalent and common gastrointestinal diseases, affecting around 9 to 23% of the population. And I saw one statistics where 50% of patients going in for gastrointestinal issues, 50% of those patients have IBS. And of course, out of that 9 to 23% of the general population that has IBS, 80% of those people are going to be female. So IBS impacts pretty much every aspect of daily life. It is not just discomfort, bloating, and pain. It includes other symptoms like changes in urination, fatigue and lethargy, low back pain, muscle aches, and people who have IBS are also usually also diagnosed with depression and anxiety. So I wanted to give a brief overview of the low FODMAP diet and how it specifically takes place. But to first understand a low FODMAP diet, you have to understand what are high FODMAP foods. So like I mentioned earlier, but here are some examples. So monosaccharides like fructose, that we find in apples, mangoes, pears, disaccharides, lactose, which we find in cow's milk, dairy products like yogurt, cheese, cottage cheese, and then oligosaccharides. These are found in wheat, rye, and barley. And then polyols are specifically going to be those sugar alcohols like xylitol, sorbitol, and things like that. And then low FODMAP foods, I just listed some examples. So fruits, banana, orange, grapes, strawberries, sweeteners like maple syrup, and table sugar, but of course excluding those sugar alcohols, because of course that would be part of the polyol group. And then vegetables, grains, and then some other safe foods. So how the low FODMAP diet takes place is there are 3 phases. So first you have the restriction phase, where you replace high FODMAP foods with low FODMAP foods, and this is for 4 to 6 weeks. This is essentially just to just clear out your system, decrease inflammation, and decrease all those symptoms. And then we have the re-challenge phase. So you reintroduce those high FODMAP foods and see which ones are tolerable. And then that is specifically done like 1 food at a time. And then this is for 6 to 8 weeks. And then the third and final phase is just the long term. So hopefully the person has an individualized diet of the tolerable high FODMAP foods and low FODMAP foods. Because we can't be in the restriction or the re-challenge phase for forever. Hopefully we get to a long-term, solution. And then I just have some pictures here. So examples of those high FODMAP foods, and then some examples of those safe foods. So this is the review article that I have chosen. So the title is The Efficacy of the Low FODMAP Diet in Treating Irritable Bowel Syndrome, the Evidence Up to Date. So what this article has found is, of course, 10 to 20% of the population deals with IBS. And the mechanism we understand, and I will discuss that more in the next slide, but it is essentially FODMAPs are poorly absorbed short-chain carbohydrates that increase osmotic load, which leads to the fermentation, thus the gas and the bloating. So the biological component we understand, and the research is catching up to prove that a low FODMAP diet is effective in managing the mechanism that is causing IBS symptoms. So, of course, the treatment and goal with IBS, especially since it's a chronic condition, is to manage and alleviate symptoms. But of course, there's no quote-unquote cure. So what they found from their article after weighing all the statistics from the different articles that they selected is approximately 86% of patients find improvement in their GI symptoms from an IBS diet. So what they also found is what is key is having provider supervision, whether it be a physician or a dietitian, because the low FODMAP diet intervention is very complicated and very nuanced and is very intuitive. So specialist supervision is key for success and best outcomes. But some key limitations from the articles that they reviewed, of course, is first and foremost, the low FODMAP diet intervention. When I was discussing it on the previous slide, as you can see the timeline, it at least takes about 3 months to do all 3 phases, or at least the first 2. And most of these research articles don't have either the resources to have their research span that period of time. So the longest articles I believe discussed in this review article, the longest one was about 6 months, but most of the trials were about 8 weeks or shorter. And additionally, evidence is still catching up to the brain-gut connection of it all, because of course, as we know, most IBS patients have depression and anxiety, so that plays a key confounding variable, of course, when we look at the results. Additionally, research is still beginning to understand the role that the microbiome plays. So those are just some limitations, but Overall, this article I thought was very good and very understandable, and I would rate it 5 stars. So, I just wanted to touch on a little bit more in depth about the mechanism of why the low FODMAP diet should work and the biological mechanism that we believe is at play here. So, in simple terms, the high FODMAP foods pull water into the small intestine, leading to the fermentation in the gut, causing all that gas and abdominal pain. And from what we understand is the low FODMAP diet decreases the amount of fermentable materials in the gut, decreasing the stress on the GI system and alleviating symptoms. Before I get into the different research articles, this scientific area is specifically very interesting because we understand the mechanism, but research is barely catching up to prove the efficacy of the low FODMAP diet. But it still begs for them to administer high quality, like randomized control trials and protocols to effectively understand it. But when it comes to measuring adherence of different people, the only perfect way that you're able to measure adherence to a specific diet if you have them in a metabolically controlled kitchen, which for the most part, these research articles don't have the means or the resources to do. So before I discuss the research articles, I just wanted to discuss that key weakness because measuring adherence to the low fat diet has been proven to be very difficult, it seems, or at least from my understanding after reading all these articles. So let's get into these 3 articles. So, the first article I will be discussing is a Saudi Arabian study, and it's the effect of the low FODMAP diet on patients with irritable bowel syndrome. And so, I thought the title was effective. However, I thought it should have had the geographical qualifier of Saudi Arabian patients because I just think that's a very specific demographic and group of people. But they elaborate it further in their abstract, so I won't deduct too many points from that. So, of course, the objective of this study is clearly stated in the title that they wanted to see the clinical impact of the low FODMAP diet on GI symptoms in a Saudi Arabian population. So, their hypothesis was that an introduction to a 10-week low FODMAP diet intervention will significantly mitigate the IBS symptom severity. So, like I mentioned earlier, it was a 10-week prospective study that they recruited IBS patients from a previous relationship with these 2 hospitals. So, that's where they recruited their patients. And there were 2 phases of their intervention. So, they had the strict restriction phase, which was the first 6 weeks, and then the reintroduction phase, which was the last 3 weeks. And then the validated assessment tools they used was the IBS SSS, which was conducted through face-to-face interviews, which I think is a little higher quality than if it were to be, on like an on-screen survey or something like that. And then they also used FFQs, which were semi-qualitative, which I think actually makes the data a little stronger, I believe, when you use semi-qualitative data in an FFQ. And then, of course, they collected their BMI. So this article was very interesting when it came to their sample size of their cohort. So they selected 45 participants total, but they only selected 20 to participate in the questionnaire data, which I understand if there were limitations, but I did not think they clearly stated why. So I will get more into that later. And then, of course, the inclusion criteria was adults 18 to 45 years old, diagnosed with IBS-D or IBS-M. So they excluded IBS-C, people that were pregnant or breastfeeding, people who had celiac disease, taking laxatives. And I thought this was interesting. They excluded people taking herbal remedies for treating their IBS/supplements. And I think the generalizability of this article is low because it's a small homogeneous demographic that is very specifically regional. So you can't really extend generalizability of these results. So, of course, the independent variable was the low FODMAP diet. The dependent variables were, of course, the severity of their symptoms, which was measured with the IBS SSS. And then the secondary was nutrient consumption that they measured with the FFQ, and then, of course, their BMI. Some confounding variables is there was no control group, so they couldn't do any comparative analysis. The adherence and monitoring was interesting because they conducted it via Zoom, and I'm assuming they had direct contact with the researchers or whoever was supervising their diet with WhatsApp. So I think this is subject to self-reporting bias, of course, selection bias. Uh, from what I understood, they did not randomize the 20 people that they selected to be part of the questionnaire data component of this research. So I fear there may be some selection bias of those 20 people. And of course, these are the control measurements that they used, the validated IBSSS. And they only recorded that at baseline and post intervention, which is interesting. So the statistical tests I listed there for you, that was the p-value that they found to be statistically significant. And what they found is severe symptoms for IBS patients who had severe symptoms reduced at baseline, it was 17.8%, and then their severe symptoms dropped to 14% after the intervention. So the conclusion is low FODMAP diet significantly reduced symptom severity, despite there being regional dietary differences because it is a Saudi Arabian population. So here I just highlighted the conclusions for you from the article. So some key strengths from this article is it effectively demonstrates the efficacy of the low FODMAP diet on this small cohort from Saudi Arabia. Some weaknesses, of course, is that very small sample size, lack of no control group, potential for skewed results because of how they selected the people for the questionnaire data. And some clinical conclusions that I can make from this is it's helpful, but wait for more research because, of course, that generalizability is very low. But it does align with more high quality randomized controlled trials that have been conducted previously. So I would give this article 3 out of 5 stars. So the next study I'll be discussing is a European study. I know that analysis was done in Sweden, and the cohort was selected from a previous low FODMAP diet intervention study that was already ongoing or had completed. So that's where they selected their participants from. So the title of this article is The Multivariate Modeling of Fecal Bacterial Profiles on Patients with IBS, Predicting Responsiveness to a Diet Low in FODMAPs. Very lengthy, a lot of words, but it is effective in communicating the objective and goal and purpose of this study. So it was to determine if baseline gut microbiota profiles can predict how well a patient will respond to a low FODMAP diet. So their hypothesis, IBS symptom severity is tied to the gut microbiome. Therefore, the fecal bacterial samples can hopefully be used as a tool to measure the efficacy of specialized specific therapeutic diets. So this was a 4-week randomized controlled trial, and there was the intervention group and the control group. So the control group received that nice diet that I mentioned in the beginning, and there was a 10-day baseline screening, followed by the 4 weeks, and it was through a digital interface, and fecal samples were collected week 0 and at week 4. And then, of course, these are the validated assessment tools that they use. So they, of course, used the IBS SSS. And then they used a GA-MAP dysbiosis test, which was used to evaluate the bacterial composition of the fecal samples. To mention, though, this specific test is not necessarily designed for IBS. It is just a general basic like bacterial profile. Um, and I think that led to some complications with the research and their findings later on. And then they used food diaries only at the beginning, at the end of the study to measure adherence. And you'll have more of my thoughts on that later. So, kind of how I was mentioning earlier, um, they started with 75 participants, but final analysis was only done on 61 of them, 30 from the control, 31 from the intervention, due to dropout and quality control issues with some of the fecal samples. So, the inclusion criteria was, of course, they had to be diagnosed with IBS and maintain their current probiotic slash reduced lactose reduced intake if already established. So you couldn't stop taking your probiotics during the study if you wanted to. And then some exclusion criteria was other GI diseases like celiac, IBD, some other diseases, and already on a restrictive diet. The generalizability is low because the cohort was very small and it's a homogeneous European sample. So results may not translate to other ethnic groups and populations. So, of course, with this study, it was a dietary intervention was the independent variable, so the low FODMAP diet. The control variable was the NICE diet. And of course, their dependent variables that they were specifically looking for was the GA-MAP dysbiosis test, meaning the change in the DI scores of the microbia, and then the reduction in the IBS symptoms, so the IBS-SS, and then some confounding variables was, of course, the adherence. So it was only measured at 2 points from the study. So I think, of course, when your only adherence measure is food diaries, that's a large response burden on the participants. So you have that going for it, as well as maybe bias to maybe look like you were more adhering to the diet than you were. And then, of course, the study was not blinded. And I think that's also what kind of motivated the responder versus non-responder distinction of their cohort. Additionally, the GA-MAP test to screen for the microbia was not originally designed for IBS populations. It's just designed for everybody. But the thing is, I'll get more into this later. They vary so much, like profiles in between people. So I think it's very weak that they were retrospectively looking for what were the changes in bacteria, but everyone had a change in their bacteria from beginning and like from the 4 weeks apart. So the data from that is not very rich, and I don't think they were able to gather any real conclusions from it. So that's how it goes sometimes. And then, of course, some control methods that they used was the randomization. So here I listed the different statistical tests that they used for this specific research study. But to note, they did have to make the distinction, and this is all tying back to how I was saying measuring adherence is very difficult when it comes to a low FODMAP diet because it's so restrictive and it's so complicated. So they had to make the distinguishment when analyzing their data, separating participants between responders and non-responders. So even in the intervention and the control group, there were responders and non-responders. And I think ultimately what that means is responders, I think, probably had more accurate adherence to their diet, whether it be the intervention or the control, and the non-responders didn't. So what they found is specifically the low FODMAP diet responders had a significantly greater reduction in symptom severity. So that kind of begs the question, were the non-responders on the intervention just not adhering to the diet as well? That's what it makes me think. And then, of course, the microbiome data, what they saw is 42% of the low FODMAP diet saw an increase in dysbiosis index scores, meaning that is not necessarily a good thing. Higher DI scores isn't necessarily positive. Whereas compared to the control intervention group, the people that were on the NICE diet, there was a 33%. So what we can gather from their results is while a low FODMAP diet improved symptoms, it did impact their DI scores, but we fully don't understand like the ramifications of that. But this is specifically back to how they measured the DI scores. You know, bacterial profiles of the microbiome can differ greatly between two individuals, and I think they were retrospectively going back to try and identify what were the changes, but they were also complicated and also varied across the board that they weren't able to have any real strong findings. So that's kind of just the game of research, though, sometimes. So here I just highlighted their conclusions from this article. So, of course, some strengths of this research is it's honestly one of the first of its kind to try and understand symptom severity scores and the low FODMAP diet with the additional component / confounding variable of pretty much all the research that has come out today of trying to understand the microbiome element of it all. But of course, it doesn't have without its weaknesses, so it has a small sample size, high dropout rate, and I think there is some questionable measurements on how they try to evaluate adherence. And especially the responders versus non-responders of it all, I think heavily has skewed their results. And the researchers do admit this as to not mislead the reader. So I wouldn't base any conclusions from this, especially the findings from their microbiome, because I think the researchers were barely trying to understand what to make of that data. So I wouldn't base any, great conclusions or new protocols off this one research article. So with that said, I give it 3 stars. Okay, so on to our last one is a clinical trial. A Mediterranean low FODMAP diet alleviates the symptoms of non-constipated IBS, randomized control study, and volatomics analysis. Yeah, I said that all right on the first time. So, volatomics, I'm sorry, I have a speech impediment. This is the analysis of volatile organic matter, so fecal samples. So this is interesting because it was specifically the subtype of the Mediterranean low FODMAP diet being tested on an Italian population, which is interesting because they originated the Mediterranean diet. So I think the title is concise, a little confusing if you don't know what volatomics means. And the abstract, I believe, was very understandable as well. And so the objective, of course, is to compare the efficacy of a Mediterranean low FODMAP diet against the standard control diet, which is the NICE diet. So That was their purpose, and their hypothesis, of course, was the Mediterranean low FODMAP diet will be more impactful because the Mediterranean diet, of course, has those anti-inflammatory properties. So this is the first study we'll be discussing that was actually blinded, but it was single blinded, and it was a prospective study, of course. So there were 3 phases to this. So the first phase was 2 to 6 weeks, and it was a strict FODMAP restriction. And then phase 2, 6 to 8 weeks, gradual reintroduction to test the tolerance. And then phase 3 was long-term personalization of well-tolerated FODMAPs. But of course, the intervention group had that Mediterranean lens. And then the assessment tools they used was the IBS-SS. And then they also used FARS, which is FODMAP Adherence Report Scale, which is a Likert scale type of question and questionnaire. So that was great that they used that. Seldomly do you see that sometimes. And then, of course, the analysis of the short branch chain fatty acids. So this was a decently large cohort, 108 participants. And I know that kind of sounds low when you compare it to other research articles across other topics, not just IBS, but specifically IBS research struggles with having very, very small cohorts. So it was nice seeing a larger cohort. And some inclusion criteria was all types of IBS except for IBS-C, ages 18 to 65, and those who were older than 50 had to get a colorectal cancer screening. Of course, some exclusion criteria, like I mentioned, was the IBS-C, pregnancy, and breastfeeding, use of probiotics, and then medication use, so specifically the ones listed. The generalizability is low because it's an Italian study that's a very specific homogeneous population. And you can't really extend those results past other ethnic groups. So, of course, the independent variable was the Mediterranean low FODMAP diet. Control group was the NICE diet. And then the dependent variables, of course, is symptom severity, short branch chain fatty acid profiles, and dietary adherence. And then some confounding variables is the FARS is a survey-based tool, so there might be some response bias from the respondents to inflate their adherence. But that's to say that goes for any survey like that you use in research. And then, of course, there might be some disparity with the adherence. So the control group showed significantly lower adherence than the intervention group, which can skew the comparative analysis. And the control methods were weekly meal plans provided to all the participants. So listed are the statistical tests that they used. And what they found is both groups did improve, but specifically the Mediterranean intervention group had a 94-point greater improvement in their severity scores than the NICE group. And the Mediterranean low FODMAP group demonstrated significantly higher adherence throughout the 6-month period. And the significance is the Mediterranean low FODMAP diet, it might be a very potentially promising tool to help mitigate and manage IBS symptoms. So here I just highlighted the conclusions from their conclusion portion. So, of course, some strengths from this article was the larger, quote unquote, cohort size. And I think the study was very well designed. Some weaknesses, of course, is the very homogeneous, very specific demographic of Italian participants. I think this is a very helpful research article, more so to show the new frontier when it comes to low FODMAP diets and how a Mediterranean diet can be a good tool against IBS. So I give this 4 stars. So, what does this all mean? Of course. So, I gave a simple summary of the four articles that I have discussed today. I have outlined the objectives, the subjects, methods, what I would personally rate it, some of their key findings, and the clinical conclusions and takeaways that you can make from it. So, if you want to pause on this slide, by all means. But then let's get into the actual conclusions and what we can actually take away from this. So the original question is, I have IBS, will a low FODMAP diet help me? Yes, I believe a low FODMAP diet should help you. However, it is very complicated and nuanced, and it is key to have provider uh, supervision, specifically a specialist. So that is key for best possible outcomes. But overall, what I have discussed here today is the scientific body of literature does support that a low FODMAP diet will help in treating your IBS and managing some of those very severe symptoms. However, diet is only one aspect and one factor when it comes to IBS. IBS is a chronic condition, and there is multiple uh, factors and dynamics that are in constant interplay. So research is only beginning to understand the brain gut connection of it all and the role that the microbiome plays. So those are some weaknesses and areas for some potential new research. Additionally, as a person who has been managing their IBS independently, kind of intuitively, is I think IBS management, and I think this goes along with all chronic conditions, is it requires a holistic approach. IBS affects multiple components of a person's life, and symptoms improve and fluctuate depending on other factors like stress, anxiety, and depression. And besides diet, I personally try to manage other symptoms like muscle aches and lethargy. I take baths with Epsom salt regularly to help with those muscle aches and ultimately to help regulate my nervous system and to help me relax. Additionally, I regularly exercise, so I personally choose to do low impact exercise. So I personally do pure bar about 3 to 4 times per week. And this just helps me decompress. Additionally, I like reading, and I am starting to play the new Pokemon Green game, which is very relaxing on Switch. And I think there are still multiple areas in research that we need to fully understand so we can have the most effective treatment protocol for IBS. But those are just some of my personal things that I do outside of diet that I have to do to manage my IBS symptoms. So here you will find my references. So these are specifically the review and research articles, and then this is my complete reference list. And then here are my image references. And then here is my poster, which is I'm very excited to talk to you about. So this summarizes my findings and conclusions from the literature review that I conducted for this project. And I just wanted to end this presentation with that this topic was very fascinating for me to gain more knowledge on, and I really found this project to be very rewarding and reaffirming because I essentially have been treating my IBS with a low FODMAP diet intuitively throughout the years with my vegan diet, which is insane when you think about that the body of evidence is really just from the past 10 years, and that's how long I've been vegan. So I've kind of been ahead of the curve when you think about it. So this project for me was a really big aha moment, because if there was any concern for me to not go into dietetics, I think that completely blew it out of the water. But I think this highlights a larger point that a low FODMAP diet is inherently intuitive, and understanding how your body should or should not respond is how you start to eliminate those intolerable foods. So going forward, hopefully when I become a dietitian, I think I will be able to provide very thoughtful and meaning insight to my IBS patients, because it is also something that I live with. So I hope that you enjoyed this presentation, and thank you so much for taking the time to view this video. Bye-bye.